It's been 75 years since the birth of modern China, and a lot's happened since then. From housing to healthcare, everything's improved, helping people live fuller, richer lives.
China has contributed to around 70% of global poverty reduction.
Building friendships around the world. That's China's idea of partnership.
Chinese leadership has been very important in bringing peace, security.
From made in China to innovated in China, Chinese tech now leads the way.
China has made wonderful progress in many areas of science and technology.
From a humble beginning to a global economic power, it's a rags to riches tale.
Yes, you can be profitable in China.
We did not observe any country to sustain such a high growth rate.
Ancient philosophy in modern practice. China shows us how we can live in harmony with nature.
When China talks about modernization, it's talking about a green future.
5 episodes, one incredible journey. Buckle up for the CGTN special series Journey to Modernization from September 30 to October 4, only on CGTN.
Hello and welcome to the CGTN special series, Journey to Modernization. Over the course of 75 years, China has transformed itself from an impoverished and developed country into the world's second largest economy. What steps had China taken to ensure continued prosperity for its people? And looking ahead, what are some of the outstanding challenges that remain? That's our topic. I'm Xu Qinduo. Well, joining me in the first part of today's discussion are Professor Fu Jun from Peking University and Hannah Ryder, founder and CEO of Development Reimagined. Let's first take a look at a video on how Lanping County, once one of the poorest counties deep in southwest China, has secured this continued development, and is taking on a new look in this post-poverty alleviation era. Let's take a look. Known as Little Siberia, this is Lanping County in China's southwest Yunnan province. At an altitude of 2,588 meters, temperatures range from 28 Celsius in summer to -10 in winter. Every July and August, this quiet land comes alive as villagers harvest their golden fruit, blueberries. This tiny berry has not only transformed the local ecosystem, but has significantly increased the incomes of the villagers who live here.
南平县乡村振兴浆果农业产业园的话是2019年重点引进的农业项目，项目种植面积的话是有7000亩，其中有4000亩的蓝莓。
这个地方可有什么独特性啊？
气候它是冷凉气候，然后昼夜的温差大，然后它光照时间比较长，非常有利于这个蓝莓的这个生长。
Back in 2019, the local government partnered with the local companies to switch from traditional corn crops to large-scale blueberry farming.
它就是传统农业，比如说种一些苞谷，种一些洋芋，然后它产出的这个产值非常低。蓝莓它是一个高附加值的一个水果，它的利润空间也非常大，一年能增加它的这个收入，个人收入的话3到4万块钱。
Different growth models have been developed here that ensure not only short-term gains, but also promote long-term employment.
县里的当引进这个项目的时候，他们的目标是什么呢？第一个目标就是带动周边的群众的增收致富，第二个目标就是希望通过产业振兴来达到我们这个农业的振兴、乡村的振兴。当地的这个农民他是怎么从这个项目中 受益的，因为我们现在当地的大多都是少数民族群众。那原来嘛，这个他们一般都是为了这个生活和收入都要去北上广深这些地方务工那我们县里把这个产业在19年引进以后，那我们的群众的收入就分成3部分第一部分就是他的地租的收入，第二部分呢就通过我们的全年的田间的劳作，那特别是我们在生产季 的收入的增加， 第三部分呢，就是我们的利润的分红，希望我们的人民群众能够在不离开故土的这个情况下，能够有一个安定的生活、稳定的收入，还有呢就是家庭能够一起的生活互相这个帮助，这样他的幸福感就提升了。
Everyone benefits from this comprehensive partnership: the companies, the local governments, and the communities. Farmers essentially rent their land to the state-owned company, which in turn hires the farmers and other workers to grow the high-demand fruit. After harvest and distribution, the profits are shared amongst the company, the farmers, the workers, and even the local community, which may receive bonuses. This collaborative approach helps everyone and helps boost the industry. All these freshly picked blueberries are ready to be transported through cold chain logistics, reaching consumers in major Chinese cities in Beijing, Shanghai, and Guangzhou, all within 48 hours.
“特别值钱。”你在这工作多长时间了？几年了？
旅游2、3年了。
以前相比，感觉怎么样？
现在感觉还好，比以前好了。生活也好了，收入也比较稳定了。每年的话就2万多，所以在这里上班的话，对我们是很好的，照顾家也可以挣到钱啊。
With the expanding scale of cultivation, the small berry industry is becoming a major economic driver for Lanping County. By creating more jobs and increasing the incomes of the local farmers, blueberries have become a symbol of hope and prosperity. This is just one example of the countless villages across China striving to develop beyond poverty alleviation. The challenge isn't poverty itself. The key is that together we can truly make a better life. I went to Lanping in Yunnan province to cover the story, to take a look at what's going on after this poverty alleviation campaign. We know that campaign lifted out of more than 800 million people, out of poverty. As someone, China observer, seeing from outside, what do you make of this effort?
So there's no doubt that it's a very impressive effort. The UN has said that China has contributed to around 70% of global poverty reduction through having helped those 800 million or more people lift themselves out of poverty. And it makes China effectively the world record holder in poverty reduction. And I think what's interesting about your experience, for example, is just the diversity of means that has been used by the government, also companies and people to come together to try to cut poverty. But we've got to remember that in China, of course, that doesn't mean the work stops. And also outside of China, there are still over 400 million people, in particular in Africa, who are still in extreme poverty. And they need to cut poverty even faster than China did. So how can we do that? And I think there's important lessons to be learned.
Earlier you mentioned about that, what are some of the experience they are applicable to other parts of the world. In this case, you see these joint efforts by the government, by the farmers, and also by the market, the company, the investment with the technology, with the equipment. Of course, there's a profit, and then it is shared. So everybody benefits from such a cooperation. Is that something we can learn from probably for other parts of the world?
I mean, most certainly it is. But I do also think the point about infrastructure is also crucial. So even in your video, you talked about this almost as a throwaway, the supply chain of the cold chain logistics.
Yes.
Cold chain logistics, there's 4 African countries that have good cold chain logistics, just 4 out of 55. Mm-hmm. So if you think about, this is a province in China. Effectively, I imagine most provinces in China have a good cold chain logistics now. But again, 40 years ago, 20 years ago, just wasn't the case. No. So it takes a great deal of effort. It takes it takes some creativity on the part not only of government but also of private sector and people to try to find those, to utilize the logistics and the infrastructure as quickly as they can to make sure that it's actually delivering and giving a benefit. So I think these are important questions about how once you, can we, number one, find the finance available for building that kind of infrastructure across different countries, but also once you do have those things in place, how do you make sure they are productive and continuously productive? How do you find these new models of investment, like the blueberry farming?
There I can add something to Anna's points. She's made very good points. You look at the government, you also look at the private sector, the market. Now, we haven't been talking so much about TVEs now because we changed it. We no longer use those names. TVE stands for Township Village Enterprises. It's a big thing, okay? For ordinary people to imagine the process in industrialization, urbanization is sort of all very urban sort of thing. But in China, do not forget, 40 years ago, we start with the TVEs, Township and Village Enterprises, and due to the unique feature of Chinese institutional arrangements, the hukou system, following the big contract, which is a big symbolic contract, symbolizes rural household responsibility system. Then you unleash almost an endless pool of labor. And when those labor combine with some form of capital, domestic, international, the very rapid rise of township and village enterprise.
Both of you mentioned about infrastructure, the importance of the role of the government. I mean, one, I think, aspect to this poverty alleviation is about relocation. In Chinese, we call 异地搬迁. You move the residents or villagers usually who live in this mountainous area. I went there. I can see people live in the middle of the mountains. There's no way for them to walk out of the mountain without today's, say, highway. Just impossible. I mean, how can you reduce the poverty? So there's this relocation. In Lanping's case, they relocate the people to this urban area in the county seat. It's a sea change for people's lives, in terms of sanitation, in terms of access to education, access to medical services is much, much better. How importance of infrastructure? I mean, is that anyway, in any sense, applicable to other parts of the world?
Part of it is around the planning of the process, because people are rational. People are not staying in their village because they're completely irrational people. They're staying there because they have some amenities, they're used to it, they understand how to manage the village. Whereas if you're going to move them, you need to be able to incentivize them to do that. So I think the point that comes out here is, if you have built something that means that they can have a real productive life afterwards, that people are going somewhere that they know that they will be surrounded also by others who they're familiar with, or that they're doing something which is going to be still farming, for example. Farmers love farming. Yep. You're not going to move them away from farming, and that's fine. So, but I think part of the problem in a lot of development work is when we're thinking about projects, we often, because we're dealing with scarce resources, especially external resources, when you go to international institutions to go and try and get money for new projects, you're having to really cut down as much as, and you can't really put a lot of finance away for things like relocation or, all that sort of thing. So it's about part of the planning process and making sure that there is enough finance available to some degree from taxes, but it can only be, countries are poor, so they only have a certain amount of money they can use domestically. But if you can get external finance, make sure the external finance allows you to compensate people enough, but not just to give them money, but to give them a livelihood. That's the key.
In the Chinese case, we talk about how successful the poverty alleviation program have been, but still, people are looking at possible potential challenges, after poverty alleviation. how can you ensure a continued development of basically every aspect of life? What do you see are the challenges, Hannah?
I mean, so what we have to also remember is again, China's program for the 800 million refers to rural poverty. And there's of course, when you have people in rural areas and if there is still poverty in rural areas, quite often they will go to urban areas. And so you can also get a lot of urban poverty. Now, again, it's really a case about dealing with disparities of income. We talked about the villagers here. They're earning, maybe 2,000...
It's about like if you work in the plant, it's about 4,000 a month.
Right, yeah, which is a decent income. I mean, look, in Kenya, our GDP per capita is around $2,000 a year, right? So those villagers in Lanping are doing really very well in comparison. But nevertheless, if you're looking, China's GDP per capita is around 12,000 a year distributed. And so the question is really, how do you make sure that is continuously balanced now? And that, and again, that's where the forces between government and private sector and community come in. You have to, at some point, really prioritize community. But for countries like Kenya and others across the board, we're still we would love to get to 12,000 per capita GDP. Yeah, that's our challenge, and we'll be happy to stay there. But for China, I think that that next challenge is around urban and also around dealing with inequality.
Thank you, Hannah. Thank you, Professor Fu Jun. Thank you for sharing with us your observation and insight. For the next part, we'll take a look at the medical progress over the past decades in China. Joining me in this part is Professor Fu Jun and Martin Taylor, WHO representative to China. Well, another important aspect of improving life in Lanping is developing better medical services. With the help from the medical assistance teams from Shanghai, people in Lanping are finding it much easier to access to quality medical services. And what is happening in Lanping can be seen as an example of what is going on in even the remote regions in China. Let's take a look. Imagine a place where 14 ethnic groups live in harmony, and ethnic minorities make up 95% of the population. This place is Lanping County, located in the remote region of southwest China's Yunnan province. Here, the government is on a mission to connect the last mile of rural healthcare, ensuring that no one is left behind. China is accelerating efforts to provide quality healthcare services in rural areas. The ambitious goal to have at least 1,000 county-level medical institutions meet tertiary standards, the top tier of hospital quality, by 2025. Behind me is the People's Hospital of Lanping County. Established in 1951, it's evolving into a tertiary hospital, offering higher-level medical services to this diverse community. Let's step inside and see how healthcare here is transforming people's lives.
那么22年7月的时候呢，我们接到任务由上海市浦东新区和浦东新区卫健委呢就委派咱们医院呢就派出这个组团式帮扶的医疗队。
The hospital now has an upgraded management model. It provides training for local doctors and nurses and has created treatment centers for major illnesses.
在这3年当中呢，我们从输血到造血，到最后留下一支带不走的医疗队。那么我们来了一共是9名医生，那么目前已经带培了当地人才呢这个35人。可喜的是，我们在新开展的165项新技术当中呢，已经50多项能够由当地人才独立培养。
Over the past 2 years, Dr. Yi and his team has been striving for a goal to treat minor illnesses without having to leave the village and for major illnesses without leaving the county.
那么从数据来看呢，我们22年的时候， 县人民医院的患者外转率已经大幅的下降了73.6%。那么2023年呢，在这个基础上继续下降了32%。那么今年的上半年又继续平稳的下降了22%。
To better meet the demands of patients living deep in the mountains of Lanping, the medical professionals began to offer free on-site consultations, diagnosis, and treatment to villagers through mobile clinic services last year.
2023年4月的时候呢，兰平县委县政府呢就率先在兰平启动了这项移动诊疗车的工作。那目前到现在呢，已经开展了20余次的移动诊疗车的服务，参与的医生呢达到了400多人，受益的群众嘛，要接近5万人次。那么从这个后来我们的去对比的情况来看，那么通过移动诊疗车的服务，咱们这个最边远的这个村寨的这个老百姓啊，这个要看好疾病的时间呢，平均缩短了1个小时左右。
Now let's join Dr. Yi and his colleagues in their mobile clinic bus as they head to a village about 50 minutes away from the hospital.
咱们这个兰平啊，有90%以上啊都是山地。兰平的平均海拔呢要超过2900米，所以虽然在绝对距离上来说呢，到县城的距离，那么有的村呢比较近，像咱们这次去的这个村，也有的这个村寨呢离得特别远，那么就难度就更大了。还有一个问题呢，就是咱们这个村民啊都非常的朴素，那么有的时候呢，这个疾病啊没有拖到这个对身体健康影响特别大，他没有这个观念来为自己的疾病做一个预防啊，或者是一个这个提出这个健康需求这呢也恰恰是我们国家这2年提出来要从以疾病为中心向健康为中心转变的这样一个思路。
以前看病嘛没有这个医疗购物车，我要搭那个车子去县医院里面看，要排队，还有好多麻烦。这里的话就不用排队，直接就来看啊。然后那些医生下面追加上来，对我们都很好，给我们宣传了一些知识，就是关于健康方面的知识。
From highly specialized medical services to convenient mobile clinic buses, we've seen improvements in China's healthcare system, especially in remote areas. Take this region, for example, where average life expectancy before the founding of the People's Republic of China in 1949 was about 30 years old. By the end of 2023, it was 70 years old. This highlights this amazing progress in China and shows how better healthcare access and quality can truly change lives. So, Martin, if you look at the video, the life expectancy, the average number, from 30 in 1949 to last year, 70 years old. What are the factors? What do you make of this rise in the years of life expectancy?
First of all, I think it's important to say that that rise in China has been quite phenomenal, that increase. There are a number of factors that we can turn to look to help explain that. With the development in China, we've seen the growth early on in the supply of clean water, sanitation, hygiene, the patriotic health campaign are very important in terms of preventing diarrheal diseases and other infections. Then when we look at programs to roll out immunization for children, other care for children, care for pregnant mothers, those are very critical and have been very critical. More recently, in more recent decades, then we see with the growth of the healthcare system, the impact that has in terms of extending longevity in life. I think it's also important when we think about that to think not just of health in isolation. So health is part of economic and social development. Health benefits from economic development, but also health contributes to that. You need a productive workforce, which means you need a healthy workforce. You need, for the future workers, you need educated children now, which means you need healthy children. So health and the overall economic and social development work together to support each other and to rise together.
Professor Fu Jun, obviously the medical services or access to medical services and education, etc., is an important part of this poverty alleviation campaign because serious illness can basically drive a family back into poverty easily in some parts of the country or the world. So here, I mean, with this life expectancy, it says a lot about the overall comprehensive, say, people's livelihood or life.
The number I have for each county, you have People's Hospital, you have a traditional Chinese hospital, you have a center for kids and the mothers, okay? And at the county, they are all equipped with 3 ambulances. So imagine, here is the county, better service, and the mountainous areas. Now they have cellular phones. Now they have vehicles. You just imagine a acute case. Get on the car, start to move towards the city's ambulance. Now, it takes less than half an hour to the 2 meet. So the access, well, within half hour, probably you have a chance to get you have a chance to get into the ambulance. This is so critical. Now it's even better. The thing you've been visiting, it's impressed me. They are not just making response for a sick person. They are engaged in prevention. Mobile, so even without knowing you are sick, you do not call me. Let's have health checks. And when you have so complicated thing putting there with the institution to back up, the result is what you see. Longevity level has been dramatically increased. This is so important. Now, China is not just an average country in the world. China is a country, it's a vast country, 1.4 billion people. We're not just talking about a city-state, okay? Yeah. Without that invisible hand, very strong, robust institution, that won't happen.
Now, like there's 95% coverage of basic medical insurance across the country. And if you look at the video, their efforts is really about to ensure minor illness will be taken care of in the village, and for this more serious illness that will be treated in the county hospital. So they have this mobile clinic services there. So how important are they to the villages, to local residents in such practices here?
They're very important, as we saw there, and they're important for a number of reasons. The first is in terms of equity. To make sure that everybody in the country can actually have access to healthcare. And one of the barriers to access healthcare is often geographical barrier, the distance to get to a facility. So by closing that gap, we're taking healthcare services closer to the population. A second aspect, and it relates to the 95% coverage of insurance, is the financial barrier. By reducing financial barriers so that people don't have to pay out of pocket or don't have to pay too much out of pocket, it enables them to access healthcare that previously they would not necessarily be able to do so. And then a third, I think, which is really important, and it's going to be increasingly important in the future, is the aspect of preventive care that we saw in the video. The future health challenges of countries like China are going to much more require prevention now to prepare for the future. If we're thinking about the long-term chronic conditions, in particular the ones that elderly people may have multiple conditions, so strokes or hypertension, high blood pressure, chronic respiratory illnesses, cardiac, we can prevent that by taking action now, but also we can diagnose early. So having those clinics closer to the population to get earlier diagnosis, get people onto treatment more quickly, is really important. Just a simple figure. There's nearly 300 million people in China with hypertension. Only 35% of those have their diagnosis and their treatment and their condition under control. So that means there's 195 million, approximately, who don't know or who know but aren't receiving the treatment. So mobile clinics and any action that can be taken to make sure those people know about their health condition and can take the right actions, have the right treatment, is what we need to help prepare for a healthier population in the future.
As a mobile clinic service, part of their mission is really to spread the information, to help people improve their knowledge about health, about your body there. How important is, Dr. Yi in the video also talked about not only treatment, treating this illness, but also prevent focusing on from treatment to health. So that's probably the current stage or the next stage, very critical in terms of the national health.
Yeah.
Absolutely, yes. And the shift from focus on treatment to focus on prevention is so important because, as we see at the moment, 88% of deaths in China are related to the non-communicable diseases. Most of that can be dealt with by reducing the risk factors. So that means tobacco consumption, unhealthy diets with too much salt or sugar or fat, excessive alcohol consumption, insufficient physical activity, and air pollution. That can be indoor and outdoor air pollution. So if we can share the preventive messages around that so people know what they need to do, but also do early diagnosis so that we can get people onto treatment, that's really important. That will be really important now and for the future burden of healthcare in China. That shift from treatment to prevention is also really important for some of the challenges that have existed a little bit from the past. So we see at the moment, for example, tuberculosis. There's still a challenge to do the last mile to eliminate tuberculosis in China. China's made great progress. So we need early screening. And those things like those mobile clinics can be vital for early screening to get people onto treatment before their condition becomes too serious.
In this Lanping's case, obviously this is also, I guess, practice in many parts of Western China, because medical resources in rich areas like Shanghai, Beijing, Guangzhou, yes, will be shared in one way or the other with people in the Western China, like here in Lanping. And so some of their medical staff will also go to Shanghai to receive training, short-term training. So how do you look at this practice?
It's very useful and very important. When we think about healthcare, and especially when we think about making healthcare more accessible and closer to the population, so that the common conditions can be treated in the villages, in the townships, and other more serious conditions in the county. In WHO, we talk about this being a primary healthcare approach, so led by primary healthcare. The biggest challenge that we see in many countries, but also in rural parts of China, is the health workforce. To be able to make that healthcare closer to the population, it requires the health workforce. So there's a couple of ways that we can address that. One is having specialists and healthcare workers come from big cities like Shanghai and provide training and provide their own service. The other is to think of the healthcare system as a system. And so you then can have the remote access and use telemedicine to help support diagnosis and those kinds of things. That all helps then bring more expertise closer to the population, makes healthcare more accessible, and provides the foundation for a strong primary healthcare approach for the future.
Martin, earlier we mentioned about this, Healthy China 2030. We know this is a comprehensive campaign to improve the health of the Chinese people. Where are we now? A few years ago, how much progress have we made?
Healthy China 2030 is actually a very visionary plan, because it recognizes that health is fundamental to supporting economic and social development. So it's very comprehensive in its vision, which I think is a great positive and benefit from it. And we've seen significant progress in some areas, the building up of the healthcare system, the health financing and insurance system. We continue to see progress, for example, further reductions in infant mortality and child mortality. So there are areas of clear progress. There are also challenges, of course, and I think some of the key challenges that we're beginning to see now relate to encouraging healthy lifestyles, addressing those risk factors that I was talking about earlier in terms of tobacco consumption, smoking, unhealthy diets, excessive alcohol, insufficient physical activity. And the challenge in that is that it's not for the health system alone. That requires the right kinds of policies and legislation for all parts of government. When we're talking about healthy diets, it involves working with the food industry to make sure that the prepackaged food that we buy, everything that we buy, has less salt in it, has less sugar, has less fat. When we're talking about tobacco, it's about making sure that everybody in the country can benefit from smoke-free indoor public places, for example, like we have here in Beijing, but it's not common in many other parts of the country. So it means that there are many children now, for example, who may be exposed to secondhand smoke. On a bus, on a train, go into a restaurant with their parents, in a shop. So those are the kinds of challenges that we're seeing at the moment in terms of the next stage of Healthy China 2030 implementation. It's about working outside of the health sector on those factors that still impact on health.
Of course, China has been trying hard to improve the overall health situation here. For example, with the latest announcement by the government to allow this wholly foreign invested hospitals in certain cities, certain regions. Martin, I wonder, how do you look at this recent step?
When we're thinking and looking at this new announcement, you can see that that will perhaps bring in some benefit in those cities in terms of access, maybe in terms of quality. When we're thinking about the challenge of the whole of China, of course, then there are the kinds of policies that we've just been discussing that we've seen in Lanping County will be much more important in terms of achieving equality of access for the population across the whole of China.
Let me share my observation. The direction certainly is correct. Mm-hmm. I want to say, why should we spend a lot of time debate about directions? To improve in whatever areas, whatever human do, you need to let different sort of ways of doing things, or if you may, use the word models. Let the model to demonstrate which one is better. As we all know, training will be very hard. You need to build your muscles. You do not expect to build your muscles overnight, okay? To maintain is so difficult. We need time. So try out different places in different locations, sort of let different models compete, and in the process, you hope we learn from each other. This is the way how you make a progress. So once moving in the right direction, pace the well. This is the way to go, it seems to me.
Well, with that, we're ending this part. And next, we will take a look at the education sector over the past 75 years, what China has achieved, has progressed, and what are the challenges ahead. Joining me in this part is Professor Fu Jun and John Quelch, Executive Vice Chancellor of Duke Queenshan University. Welcome to our show, John.
Thank you.
If you look at this, we talked about poverty alleviation, medical services in China. Another important aspect to poverty alleviation is really education, in particular compulsory education. If you look at China over the past 75 years, for example, in 1949, about 80% of China's population was illiterate. By 2022, the illiteracy rate has dropped to 2.67%. So that's a huge drop. So John, I mean, how do you evaluate the progress, I would say, the progress over the past decades?
I first came to China in 1981, and therefore I've witnessed the extraordinary economic and social transformation of the last 40, 45 years. And I don't think any country has improved its literacy rate as greatly as China has during that period.
Well, let's take a look at this higher education here in China. China has built the world's largest higher education system. Now, as many as 250 million people in China have a higher education background. About 1 out of every 4 employed people here in China at least, have a bachelor's degree. So, I mean, that is in terms of the scale, in terms of this particular area in higher education, that's really something, right, John?
Well, in every country, an increasing percentage of the population have bachelor's degrees. But what's more important than whether or not they have been issued a certificate is whether or not during their bachelor degree education and earlier, they developed the skills necessary to be long-term contributors to society. And these skills require, for example, critical thinking, analytical problem solving, the ability to work together in teams. These are life skills that are much more enduring and in a way more important to learn at university than the pure textbook knowledge. What I think is especially interesting in China is the government has done a very good job of putting in place significant incentives to faculty members to really develop their research skills, to step up, to respond with proposals to very challenging and formidable but well-funded government projects. And that of course, is fueling and incentivizing higher quality research in many Chinese universities. What I'm slightly concerned about is that with all the emphasis on research and advancing science and technology in particular, that those who are really dedicated teachers, but not necessarily cutting-edge scientists, those dedicated teachers may not be receiving the level of encouragement and acclaim that they deserve for their efforts.
Professor Fu, you were nodding your head. There's a lack of balance.
No. We agree very much in a way. But the moment we take science very seriously, of course we should take science humanity very seriously, but do not forget about the philosophical component. Okay, remember all our faculty members increasingly so get a PhD. What is a PhD? A doctor of philosophy in the particular field.
Right.
Philosophical thinking, ideas are so important. How do you get those ideas mathematized, then into the physical world, into the engineering? By the way, Chinese system, my personal observation is that we are now capable to train a lot of engineers. So if you look at the very subtle ladder, philosophy, mathematics, theoretical physics, experimental physics, engineering, then you build your skill up that has an impact on human life, including social sciences and humanities. And that balance between the two is so important.
On that, we are coming to the end of today's discussion. I'd like to thank our distinguished guests and our audience of the students for joining us of this special CGTN series, Journey to Modernization. I'm Xu Qinduo. See you next time.